Hello, welcome back to the David Watson podcast. Today I spoke with Dr. Jimmy Moley, a professional who deals with high performance athletes, executives. We had a great conversation about mental health and characteristics. Good morning to you. How are you doing?
Doing well. Thank you for having me.
You're very welcome. Thank you very much for agreeing to come on when I reached out to you. It is appreciated. Where's a good place to start with what you do?
So I can tell you a little bit of background about my work and maybe my training. I think that'll help inform our discussion. Yeah. So my name is Jimmy Moley. I'm an adult and sports psychiatrist based in the U.S. in the Cleveland area. And my work involves the mental health treatment of athletes and executives. So I work a mix of medication management and psychotherapy to relatively high performers, people who are focused on performance. And that involves both treating mental illness as well as using mental health tools to optimize performance. So that looks, very different for people in different areas, but try to approach mental health relatively holistically to help optimize performance.
Because I think there's a kind of misunderstanding sometimes that high performers are just coasting mentally through life.
Yeah, absolutely. And I think that also leads to increased pressure, right, on the individual. They think it's supposed to be easy, right? They've had all this success, so it becomes that much more difficult. So part of my work is to, set realistic expectations, to, remind individuals of all of the hard work they've been through and how we can use those tools to help them achieve future goals and keep striving for continued success.
Yeah, I used to have this theory. I think it just occurred to me like 20, 30 years ago, that the biggest problem you have if you have success, especially when the rest of the world sees you successful, is if you wake up feeling pretty crappy, you can't justify it for yourself. Whereas the person who's doing 40, 50, 60 hours a week in a factory, trying to make ends meet, trying to keep a roof above their head, they can justify feeling shitty and I've got nothing to be happy about. Whereas somebody that materialistically at least appears to have everything that everybody wants, I think it's a real burden when they wake up and they're like, I should be happy, I should be amazed, look at all these things they've got, because they've got no comparison chart.
Definitely. And I think, David, to your point, right, a lot of times what I discuss with clients is the question of identity, right? Who am I and what is my role in the world? So if someone who sees themselves as highly successful, highly accomplished, the world sees themselves that way, there's no room for any mistakes, right? There's no room for any kind of slip-ups. And we know that that's just not the reality. That's not the human experience. So, I think part of it is understanding, kind of the balance, right? The need for balance in life, both in kind of small day-to-day measures, but also kind of big picture measures. So I think that's a key point, understanding, the full range of human emotion, and that probably is necessary to continued growth.
As humans, why do we kind of do that to ourselves?
I think it probably goes back to, how people are successful in the first place. Sometimes, high levels of success require incredible amounts of dedication. If we're going to use the athletic realm, for example, athletes start from a very young age with hyper specialization, with different trainers, coaches, right? It requires 100% dedication all the time to reach the highest levels. Now, when you get to those highest levels, you're amongst your peers. Everyone has done, a relatively similar path. So now it's how do you set yourself apart and how do you distinguish yourself? And that can often be difficult. So I think initially it's adaptive. It's a way to get to the top of the mountain. But then once you're there, oftentimes it can be detrimental because that's all you know, right? There was no other plan. There was no backup. There was, oftentimes very little development in other areas of life.
Yeah, that reminded me, I was listening to two former football players, soccer players to you guys, talking about a former teammate who they said could have been like one of the greatest ever. And I was only listening to this morning. They said, but he didn't have the mentality of a Zidane or someone like that. And that must have its own problems. If you, like you say, by the time you get to the top, all your coaches, all your peers are probably people who were at your level at their peak. So if you can't match their bar, even though you still might be one of the best at what you do, you can maybe reflect that perhaps I'm a failure.
Definitely. And I think that, if we stick with that example, right, maybe that person, doesn't quite have the makeup or whatever mentality, personality style to reach that level, but maybe that's not what's going to bring them happiness or fulfillment. Right. And I think we kind of get caught in this idea that every athlete has the same goal of reaching, whatever the height of their profession is. But that's not always necessarily the case. And I think that when we have that misalignment between maybe personality style, makeup, whatever word we want to use, and the, quote unquote, perfect outcome for that sport, when those things aren't aligned, that's where we see the most conflict.
Do you get, when you're talking about alignment, would that include people who kind of they've come through kind of childhood, teenage years, and they're constantly, you're going to be this, you're going to be that. And that's really easy to follow when you've got people pushing you, pressing you and stuff like that. But when you become an adult and you kind of develop that greater ability to think for yourself and what you want, when you're a teenager especially, you don't always know what it is that's going to make you happy. Whereas when you're an adult, you're sometimes like, yeah, do you know what? This doesn't make me happy. Do you come across people in your own practices, like whether it be athletes or successful people, that they've kind of obtained all of these dreams, but then realise, actually, I never wanted this?
All the time, David. That's
it's tragic. It's tragic when you say all the time.
Right. And oftentimes, I mean, in my line of work, right, I'm called when there's issues, right? That's the nature of it. So oftentimes too, I'm called after, acute changes, injuries, retirement, transfers, free agency, right? So I think oftentimes change and advances in career often point out, hey, that this doesn't line up with what I want to do. And like you said, from a young age, I mean, there's so much pressure and there's so much drive from maybe people with different interests, right? Parents might have different interests, coaches, trainers, they all have a stake in the success, whatever that means, of the athlete. So I think, a refocusing and in my line of work, trying to elicit from the athlete a sense of what do you want to do? What are your goals? How do you see yourself both now and 10, 20 years down the line? And how can we take steps towards doing that in the present moment?
I just want to backtrack a little bit. How did, where did it start for you?
So, I always knew that I wanted to go into medicine and always had an interest in sport. So originally I was thinking more of like the sports medicine, orthopedic route, but I was really drawn in medical school to the idea of psychiatry, to the personal connection, the human connection. And when I realized that, mental health and sport and saw the growing, I guess, popularity, I guess is a word to use, but the growing interest and awareness of the role of mental health in sport, I really thought that was the perfect fit. So, I like to work with athletic populations, grew up playing sports and had a family who was very involved in sports. So being able to work within that culture is something that brings me a lot of fulfillment.
So what is it was there a point where you could align the dots and say, oh, actually, this is the path between kind of how somebody manages their mental health and how they become successful?
So I think what we're learning is that in the past, mental health used to be more reactionary. So when something went wrong, where you would have some sort of crisis that would lead to a mental health issue, there'd be substance use, maybe, at the most extreme form, like a suicide attempt or things like that. What we're learning now and seeing more in today's athletes is that we can actually use mental health as a proactive tool, just like physical training, exercise, or we can actually work on mental skills and different things that help optimize that part of performance that could also create a competitive edge. So I think that's a big transition that's happened in the past, probably 2 to 5 years, as we're seeing it now utilized in a more positive way, which is definitely good. And I think that, and kind of in seeing even in myself, like and other kind of professionals, right, as you go through training and you go through all this, you realize how big of a component the mental side is. So seeing that in myself, seeing it in other people, and realizing that I could help other people, achieve that and utilize that was a big factor in my career path.
What did you come across when you're like you say, people tend to reach out to you in crisis, not so much proactively? Is there a common theme, especially for somebody who, if they're listening and they're like, Do I need to speak to somebody? Because there's a, like you said, sports professionals, business professionals, and all of that there is a key to what they do and what they achieve. But the mental health side is a leveler, because anybody who's kind of suffering is suffering regardless of what sort of barriers have you noticed where people like, actually, if you'd have come to me then instead of then, we would be in a different place?
So there still remains tremendous stigma in all walks of life against mental health. That is and has always been the number one barrier, right? There's an association between mental health issues and weakness, and lack of willpower, and in lack of just overall strength. And we know in a lot of or slash most cases that that's just not the case. So we know now that mental health is influenced by genetics and life situations and so many factors outside of our control. So what I see a lot is people who, do, like you said, do come at moments where it's pretty much rock bottom. And they say, if I wish I would have maybe seen the signs a little bit sooner, or sometimes we see the signs and don't want to recognize them, thinking that that's a sign of weakness or something that we can just, apply more effort to and overcome. And that's, in athletics, that's kind of the unique challenge, because in every other challenge you face, the answer is usually just more effort. Right? If you're having trouble, if you can't, lift a certain amount of weight, well, more effort, you work up to that. It's not the case with mental health. You oftentimes even more effort just leads to worse outcomes, kind of paradoxically. So I think, and that's why I do a fair amount of education in trying to say, what are the warning signs that maybe we're starting to head down a destructive path, or what are the warning signs that, we can try to anticipate challenges before they happen, recognize them, and try to head them off before it derails a career or something more tragic.
When you say more effort can make it worse, how so? I've not heard that description before.
Right. So, I mean, I think of an athlete maybe facing, maybe severe depressive or, anxious symptoms. Oftentimes, you're headed down a pathway, like a mindset that's leading you down that way. And the more you just push and the more you try to get, work through it, oftentimes that just leads to getting more stuck in those cycles. Right. So, really trying to put in extra effort sometimes isn't always the answer. And it can lead you to maybe look for outlets that aren't healthy, like substances or overtraining, right? I think that's a good example. Somebody who, maybe, just more and more time on the pitch or at practice, and all of a sudden maybe develops an eating disorder or develops, body image issues. So I talk a lot about moderation, about balance, and about kind of weighing your priorities in order to kind of optimize wellness across the spectrum.
When you say weighing your priorities, what would be an example of that?
I think, seeing athletes as individuals that happen to play sport and not only athletes. So just making sure that we're spending time developing, athletes as, friends, partners, husbands, wives, right? And understanding kind of your different roles in life. What are your goals, both short-term and long-term? And maybe asking, kind of hard questions like what parts of you need to be developed to reach the goals that you want to reach, right? Maybe what aspects of your personality, of your career interest, maybe just need some more attention or oxygen to get there. And those are, sometimes you discover some things that have maybe been pushed down for years, right? In an effort to achieve more athletically. So it's maybe bringing some of that out, understanding what your goals are, and realizing that there's probably a pretty good chance that more balance and more attention to those aspects of life will ultimately improve athletic performance as well.
This always seems to be, there's this continuing theme, isn't it, where it's still always connected to how you perform, which obviously ties in with what you do, because obviously there'd be no point coming to you if you couldn't help somebody maintain or improve their performance. But it kind of also is, I wonder if sometimes it feels counterintuitive, because it's the pressure you're trying to put yourself under to perform that's causing you the problem.
Right. It is, absolutely. And that's what I kind of mean, getting stuck in that cycle. But the other thing too is that I'm privileged to work with athletes because athletes are highly motivated, right? They want to do whatever it takes. And they have a lot of skills to get there. It's just not always recognized, kind of in that realm, right? They have, really high levels of discipline, work ethic, concentration. That's something that a lot of times the general population struggles with. So it's like, now how do we leverage these tools just in a different space, right? How do, we know that you want to do everything it takes to succeed. Well, now let's apply that to the mental health side. So that's why I think it's such a fulfilling type of work, because I'm dealing with individuals who are maybe more motivated than anybody to feel better, to perform better. So it's, I think it's a good group. They face a lot of unique pressures, but they also have a lot of unique advantages that we can leverage.
And do you find that's the same with people in sort of professional business who are at high levels?
I do, and that's kind of where my work has taken me to the more higher performing executive types, and that even applies to different types of performance. Dance, opera, singers, ballet, even those like in the military. Right there's so many similarities, and it's kind of cool on my end to be able to see that across different walks of life, and to understand that there is probably something about that high performing executive mindset that drives individuals to succeed. And then at the flip side, a lot of them face very similar issues, right? So being able to maybe use that experience to point out maybe things here and there, and give them the space to explore where they can improve.
What are the sort of, if there were character traits, because it's very different, like you say, opera to the military, but I could see connections between the top military and the top athletes, because but when I think of, then if I try to give it some thought, I'm like, well, yeah, because an opera singer has dedicated X amount of time to rise based on a talent. It's not just learning to sing, you've got to be able to perform in a way that an audience puts you above everybody else. You've still got the approval of your peers. You're still got to be in the 1%, the top 1%. Otherwise, you're just a singer. Do you know what I mean?
Right.
So what are the characteristics or the traits that are familiar? Like if you're talking to somebody, there's 9 times out of 10 they've definitely got 1, 2, 3, or 4 of these traits.
Definitely, I think these individuals are very process oriented. That's one of the biggest things. They're very data oriented. So, when I talk about maybe some sort of treatment plan, right, that people, high performers typically like to know all of the details. Like they want to know the reasons why. They want to know my thought process and the steps that it's going to take to get there, right? It's almost like we're laying out a game plan. And I oftentimes use metaphors related to whatever field they're in, right? So this idea and this mindset that I want to achieve a goal, and in order to do that, I need to practice and dedicate X amount of hours. I need to focus on my body and different parts, right? And optimize sleep. So they're used to that mindset of preparing for big moments, oftentimes that are very result oriented, and oftentimes that take days, months, years to prepare for. So there's this idea, I think, of hard work, of performance, of kind of this holistic dedication that I think I see pretty much universally. And then it's how do we channel that? How do we kind of find maybe the points where there's been some conflict or some issues there and optimize that? But I would say more than anything, it's a dedication to process. It's an interest in data and reasoning, and it is a performance mindset that involves lengthy preparation for high intense, high in pressure moments.
I suppose that's. I think whenever I've spoken to people, I think that's probably one of the hardest things for. I'm going to say average person, but I don't mean it to be derogative. To understand that the higher the performer, there's an intensity that surrounds them, because they're so focused on the outcome of the achievement that almost achieving it is irrelevant. It's I see it whenever I've had these conversations with my mum, where she'll talk about arrogance and stuff like that when we're watching sports. I have to say, you don't understand. That person cannot be at the level they are and consider someone else's feelings. It's because the minute you do that, the next athlete isn't doing that, or the next businessman isn't doing that. They're focused on their goal, and I don't think the average person is capable of doing that. Even if you try to train them, there's a level of compassion or self-doubt. I don't know what it would be that we can actually have a discussion about limiting factors or limiting beliefs, but it's they are so targeted that they can't see anything else.
Definitely. I think there's a selection for that, right? I mean, we think of like famous athletes and famous stories like Kobe Bryant, right? Almost delusional levels of confidence and belief in yourself. So if we're selecting for those traits, then we know kind of these populations and the challenges that come along with that, right? So yeah, I totally agree. I think I see that very commonly in all walks of life. And the trick is then to increase awareness of that, to understand that this is what made me successful, but it also might be causing some problems that we can maybe help address.
When you mentioned like Kobe Bryant, but I would say it applied to everybody. Are they as confident as they appear, or is it just the repetition of practice, that preparation that you talk about, that makes them, well, this is just what I do?
I think it's a mix of both. So I think in order to succeed at the highest levels, I think there does need to be some sort of belief that something you're doing is different, right? That you have some unique ability that is different than the person next to you. I think that's almost a necessary condition, I think, to succeeding at the highest levels. Now, with the same token, I think that there's a lot of individuals who, kind of just know a certain path. They put in a certain amount of hard work and are able to succeed at high levels as well. So I do think there's probably a confidence factor. It's probably not the only factor that goes into high performance, but I think that, more often than not at the highest level, that's what we see.
But ultimately it's that belief that, no, I am just better than you.
Mm-hmm.
And then I suppose one, results matter, that helps you maintain that belief, and then the other is just your willingness to out practice the other guys until you're so sort of talented that like that thing, I'll be the hardest worker in any room I walk into, and I suppose when you can walk into the room and do that against the supposedly best. But I'm fascinated by the fact that, like I said, when you just because you mentioned Kobe Bryant, but I know it applies to others. Even when they're at that level, they're still doing their best to work harder than everyone else. And that's that weird thing about greatness, is they never seem to. Yeah, I'm trying to picture it as I'm talking to you, because there's people that achieve, and then kind of when they get, you see it a lot with boxers. They get the belts and then can struggle to hold on to them because they get world champion, they've achieved something. And then you get someone like, you just had the Canelo and Crawford fight. Like the high level that Canelo has fought across so many different weights. And he was still beaten by Crawford, who again has excelled across different weights. And it's just like the levels that they've maintained everything to be the best at different weights until they finally collided with each other. And it's how, I like, maybe it's a genetic thing that you mentioned earlier. There's genetics come into it, because everyone's always looking for that key, aren't they? Like, what separates even the 1% from the rest of.
Mm-hmm. Yeah, and I think that 1% probably gets derived from many different factors, right? I think if you don't have a certain genetic makeup, it's, in some cases that is exclusionary. But I do think it is probably that sum total of everything. And I think you make a good point with boxers too, that there is a very clear outcome at the end of those events, right? But oftentimes, like you said, sometimes upon reflection, the outcome is maybe less important in a way. That you understand, right? The preparation and the intensity, that if you can reach that point to understand that, it is about self-improvement, it is about achievement. And oftentimes the results of games, matches don't always reflect that level. So that's a skill that I often work on, right? Is how do we hold those two things together? Those two things that may seem opposite, but oftentimes coexist together.
Do you know who Dorian Yates is? He was a bodybuilder.
I've heard the name.
Yeah. He was back in the 90s. He was 6 times Mr. Olympia, which I think Lee Haney was the only person. Is it Lee Haney? I think it's the only person to bet. There's a few, do you know what I mean, who are like in that GOAT category. And I was listening to him this morning, and he was saying like the end result is irrelevant. He said it was how I got there. He said everybody talks about, achieving the wins, but he says, but none of you talk about the enjoying the process, the years it took to do it. He says that's all it matters, is what you're doing in the build up to everything. And he just, it's similar to that thing that, yes, the outcome matters, but it was more important to him about how he got to the outcome than the outcome itself. And you're just like, but I don't think like that.
Right. Well, it begs the question: how do we define success? Like, what is the intended outcome here? Now, I think if you ask a lot of athletes why they started in sport or why they got into sport, it's probably because they really enjoyed it. Right? They enjoyed practices. They enjoyed being around like-minded people, hanging out with friends. It's a way to connect. It's a way to relate. It's a way to push yourself, to challenge yourself, and that's what's great about sport. Oftentimes, youth athletes don't go into sport thinking my only goal is to win a Super Bowl, right, or have an undefeated record, or win certain matches. I think trying to remind athletes of where the joy comes from, right, and the joy sometimes does come in that day to day, into the grind, into the how it helps you relate to other people and how you see yourself as a result. So the question of how we define success is central, and it kind of questions what are the goals of what we're doing here, and then how does that inform then how we approach it.
Okay, just changing tack slightly. How do we create our anxiety?
Do you mean where does anxiety come from, or what do you mean by that?
Well, just that, because anxiety is often, for want of a better term, is self-inflicted. Do you mean, unless you're in an actual state of where something or someone is chasing you down, people can just, it's happened to me in the past, but it can happen to you. Just sat there watching TV, suddenly you feel anxious and you're just like, whoa, where does this come? And if you can't get a hold of it, you can, and again, it's one of those things. It's like, why does it happen to some people, not to others? So where does, when we go down that process, where is it coming from? What is it that's happening?
Sure. I think there's a biological element, right? There's a genetic, kind of more chemical based element, but then there's also a socially adapted element. So what I mean by that is that if me or you were in the middle of the woods and we came across a bear who was charging at us, right, we would feel anxious. Our body would tense up. We would shift into kind of what we call fight or flight mode. That's healthy. That's an adaptive response. And I think we've probably evolved over the years to select for those kind of traits. So anxiety can definitely be healthy. And I think the way that translates to athletes and high performers is before a match, before a game, you want to feel a little bit on edge. You want to be able to lock in and focus. So anxiety can definitely be healthy. Now, where does it cross the line, right? And where does it become destructive? Is a question that probably depends on the individual and probably comes from a number of different factors. So some people may be more genetically predisposed to panic attacks or things like you said, where you're sitting on the couch, right? And all of a sudden feel overwhelmed. I think when it starts to impact performance negatively, when we get stuck in kind of thought loop cycles, I think some of that is learned and how we respond to stress, right? But some of it probably is biological as well. So that's why in my approach, right, we're trying to address many different factors that affect anxiety. If that is the chief concern, we're looking at we're looking at medication, but also lifestyle adjustments and how we relate to anxiety when it does come on.
What would be, when you say how we relate to anxiety, what would be an explanation of that?
Sure. Well, I think so. The world teaches us that, when there is something uncomfortable is to try to get away from it as quickly as possible. And I think that's a natural thing, right? If we're in pain, we want to not be in pain. So I think what that teaches, though, oftentimes is that if we feel anything uncomfortable, we need to get away from it however way we can. And I think where people turn then to problems is when they turn to unhealthy ways to get away from anxiety, right? People turn to alcohol or, negative kind of coping skills, gambling, right? Things that take the edge off, but ultimately lead to more problems. So what I say, learning to relate to it, I think the challenge often is how do we sit with anxiety? How do we try to learn from it? How do we try to experience it, understand maybe a bit more where it's coming from? And by doing so, hopefully reduce the intensity and the frequency of the symptoms. It's oftentimes leaning into it and running, towards the discomfort as opposed to just finding ways to get away from it, which oftentimes is only temporary and leads to, more problems down the road.
But you mentioned as well about that thought process loop.
Mm-hmm.
So what is it that people do then that kind of, well, I suppose it becomes a literal vicious circle?
It does. Yeah, the technical term is a negative feedback loop, right? You have one anxious thought, and all of a sudden that leads to three more. And it just kind of spirals out of control almost exponentially. And oftentimes this involves, kind of negative thought patterns like catastrophizing and thinking of the worst possible case scenario. And these are things we know that anxiety does, and it can play tricks on the brain. So the trick then in trying to reverse that is to really kind of mapping it out, looking at the data, taking good notes and understanding what the warning signs are when you're starting to go into that slide and figuring out strategies to circumvent that cycle.
So if you're sitting down with a business person or a sports person or whatever, and they're like, okay, I've started getting panic attacks. I was in the middle of a Zoom call and somebody's talking to me. I'm having a panic attack and I don't know how to deal with, like where the hell has this come from? I've had 3 in the last month, and now what is it you would? Yeah, so sort of what would the plan be, like where the conversation would start, and what would you, at the end of however, ever many sessions that is, what is it you'd be trying to help them figure out and understand?
Sure. The first step is understanding and always awareness. So I think we would first get a very detailed history about, the pattern, the onset, what they feel like. Let's gather data, right? I think this makes sense to a lot of business-minded professionals, right? Let's get a good understanding of the problem first. And through that, maybe we try to do some analysis of, hey, is something going on at home? Are there other factors, right, that may be contributing? And then treatment looks like many different things, right? So it might look for some short-term medication, maybe to help alleviate the symptoms. Maybe it involves therapeutic sessions where we can really sit down, explore the feelings, maybe look back through life or recent events and see what maybe led to this moment. And then maybe it also involves some lifestyle modifications. Maybe we're adjusting sleep. Maybe we're looking at the exercise regimen and trying to optimize other things that have a residual effect on anxiety. So I'm a big believer in I think a lot of people think that sometimes it's easy just to take a pill for anxiety or things like that. I think it has to be addressed holistically and as part of an overall shift in behavior. It can't just be one thing or another to relieve the symptoms.
So how much of it do you think is somebody consciously or subconsciously feeling that something is beyond their control?
I think that's a part of it, right? I think that's part of the trick that anxiety plays on us, right? Mental health is unique in that it's one of the major illnesses that actually convinces the individual that they're stuck in it, right? That there's oftentimes a lack of insight. If you have diabetes, we can look at your blood sugar, right? If you have high blood pressure, we can look at your numbers and take medicine and watch it go down. For anxiety, there's no way to measure it, right? It's just kind of subjective. And when the illness makes us feel a certain way, it makes it really tough sometimes to see the forest through the trees. So that's where, having people that you can trust, having good professionals that you have in your network can really help, because it's oftentimes when you're in those cycles, it's very difficult to break through.
Because that's something I've not really thought about before is, mental health, anxiety, they're not measurable, not like a blood test. You can't blood test for anxiety. So somebody could be just surviving on a daily basis and there's no way of making that measurable. So what I know you said like there's an holistic approach. It's not it's not one hat fits all. But what is it you want people to do? Like you say, you gather the data. So and that could be talking about something that's happened in their past. Is there something going on at home? But then what do you start looking at? Do you then start looking at like, well, do you exercise? What do you eat? Do you drink? Do you do drugs? Do you know what I mean? What is it you're trying to shape or understand about that person?
I'm trying to get a very kind of big picture, but also at the same time detailed view of what are all the factors that are affecting their symptoms. We know that almost every aspect of life affects mental health. So like you said, sleep, exercise, diet, right? Childhood history, family history, genetic components, biological components, right? Other medical diseases, right? There's so many different factors. So it's my job in the initial assessment and the first few sessions especially to try to get a snapshot. And then let's prioritize. What are the things that are modifiable, right? We can't change your genetics, right? But we can change your sleep patterns. We can change your exercise regimen. We can maybe add a medication to help downregulate your nervous system when you start to feel anxious. So it's identifying and prioritizing modifiable factors that affect anxiety and mental health. That's the overall kind of main strategy of the early sessions.
Okay. And I suppose then it's because of the type of people they are. They then just put it in as a plan. They're just like, okay, this is what we do.
Yeah, I mean, we lay out. I use the term game plan a lot, right? We're gonna lay out a strategy. We're gonna have a strategy, but also we're gonna be adaptable. That's one of the biggest things. We're gonna try some things, and inevitably some parts of the plan are not going to work. So it's how do we adjust to that? How do we be flexible? How can we kind of manage maybe disappointment or manage expectations in a way that allows us to adjust on the fly, make adjustments, and really be able to optimize in the long term.
Yeah, how do you help people manage expectations?
I think setting expectations at the very beginning is one of the most important things we can do. I prescribe a medication that has, a certain % chance of helping. But honestly, mental health research and literature is not as advanced as it is in most other fields of medicine. Right? We don't have a great way to predict how someone's going to respond to an antidepressant. Sometimes it may take 2 or 3 antidepressants before we find the right one that works. That's the unfortunate reality of mental health and our understanding at this moment. Now that may improve in the future. I hope it does. But with that, we need to set appropriate expectations and understand that medication is just one piece. Exercise is just one piece. Therapy could be a piece, but all of these pieces together, that synergistic effort, is ultimately what's going to make things work, right? Is what's going to kind of push the needle forward. And if one part doesn't work, we're compensating with other parts of the treatment plan.
I didn't realize that we didn't know much about mental health because it's so spoken about. I know there's still a stigma attached to it, but if we've just had mental health week in the UK. I don't know if it's an international thing, but I probably know more about mental health than I do diabetes. It's so do we not? What is it? Because we know what it is. Is it we don't understand how it happens, or?
That's a part of it, right? I think that, so let's take, for instance, depression. So the medications that help treat depression primarily increase serotonin in the brain. Okay. Now, I think what we don't necessarily understand is that why sometimes more serotonin helps relieve depression. It's like, what is the exact mechanism? Like, how does serotonin work? For diabetes, we know about insulin pumps and the flow of, sugar throughout the body and how that affects your organs and things like that. We don't have a great understanding with depression. Like, we know that sometimes more serotonin helps, but we really don't know why. So, there's different theories, and there is active research right in this area. But some people don't even respond to these medications. Why not? Or how can we predict that? There's still so much room to go. Now, that as a result of all of that, it makes having a provider who you trust, who you can contact very easily, who you can access, all the more important. Right? If you go to see, a general practitioner, they prescribe one antidepressant, and you follow up in 3 or 6 months, if that doesn't work, that's a significant time to be set back. So I think it just emphasizes even more the need for good quality mental health care.
So do we understand how depression happens?
I would say it's probably different for everybody. I think there's probably multiple factors involved. So like I said, is there a biochemical element? It seems like it, right? Because when we increase someone's serotonin, that they probably do feel a little bit better, right? But we also know that probably some of it has to do with genetic elements. We know it probably has to do with life stressors, right? There's probably other processes going on in the body that we also don't understand, right? When someone is depressed, they oftentimes have elevated what we call inflammatory markers. And those are, people with like autoimmune disorders or certain types of other medical illnesses also share that too. So is there an inflammation element? Is there a role of that sort of thing? And, we don't know. The answer is probably, but at what %? Hard to say. So I think we're, it is definitely an art and a science. We combine what we know with what we think we understand and what works for each patient. But it is definitely unique in the medical world, which is, both interesting and challenging at the same time.
Do you see similarities though? So what I'll give you an example is I'm a qualified hypnotherapist, and I don't practice much these days, just because I already have a full-time job. But I had some success for quite a while with a fair few people who had some form of autoimmune disease, like celiac, fibromyalgia, or something like that. And it was just simply reducing stress. That was the trick. Was just a thing called the world's most comfortable, cuddly, snuggly chair, and you just got them to relax under hypnosis and just let it go. Not even really discuss what might be bothering you. Just image examples of letting things go, like dirty water in a sink, pulling the plug out, letting it all drain away. Just whatever it was, with descriptive words about emotions, anxiety, stress, and just let it all drain away. And I never figured out whether... So my own kind of... The way that I would explain it to somebody is if you go from a scale of 1 to 10 as to what the body can cope with as stress, as soon as you get above 10, the body will create a physical symptom to say, I'm in trouble. Okay. Now, you may already have had that as an illness, but it was never developed, was never shown to you by the body because you were never stressed enough. Or because you got too stressed, this is the way your body's communicating with you. And all I would say to people is all I'm doing is keeping you below 10 on a daily basis. I'm not curing anything. But the common factor was all of them lost their symptoms. But the only thing I actually did was tell their body they didn't need to be stressed anymore. And and it would only last, treatments would only last, I think the maximum anybody ever was really successful was about 6 to 8 weeks. And then just because literally their daily life, they would just get stressed. And I never ever figured out a mechanism that would enable them to just never need to come and see me again, if that makes sense.
Right.
So when you look at like mental health, depression and stuff like that, do you see, like, although everybody is individual, do you see common factors that seems to be related to almost every single person that you're treating?
Definitely. I think, we do know very concretely multiple things through research. One is that, the more episodes and the more symptoms you have, the harder it becomes to treat. Right. So
I didn't know that
speaks to the need. Yeah, it speaks to the need for early intervention. Right. Like, so people with depressive or anxious episodes, the longer that goes untreated, the harder it is going to be to get back to baseline. We know that, like you said, people with certain stress levels, right? People of certain genetic backgrounds and makeups. And, we know if you have a family history of depression, you are definitely more likely to struggle with that illness. So there are some things, right? Certain guideposts to help us, but then there also are like a lot of individual factors, right? And I think you make a good point, right? That in general, that we need to reduce stress levels to start. I think medication can help with that. The way I often describe it is that, if you're drowning, medication can maybe help you tread water. All right. But it's not going to allow you to swim. It's not going to allow you to take that next step for mental wellness, right? No pill can provide you life satisfaction or life happiness. That has to come from the individual. Now, medication can make it more easy to do that, more accessible to do that. But that's really just the first step, right? Like, in order to swim, you have to engage. You have to work on things and really look for those life moments. So I think it kind of speaks to that, it involves both personal effort and probably some, reduction in stress externally to really create the best outcomes.
But what would be examples like you see, is it watching too much news? Is it watching too much social media? But when I say that, I'm well aware that people had depression in the 40s, 50s, 60s, 70s, long before the internet, and even when times were much, much simpler, depression still seemed to exist. I don't know any of the literature about anxiety before the internet, I'd say, but I imagine it's existed,
Sure. Yeah. I mean, I think with everything, right? There's positive and negative aspects, right? There's people that watch the news for a living and are perfectly, well adjusted and well balanced. There's people that use the internet to achieve success like they've never had before. So there's definitely beneficial and negative aspects to almost anything in life, right? So I think that the key is the universal thing is watching that balance. So noticing when stressors are, less productive, when they're actually kind of creating, destructive kind of mental processes versus when we're using it for good. So as a general trend, I think we need to look at, kind of first of all, what is the line between what's healthy and what's not healthy, and what is causing us to cross that line? So in a way, it's individual, but in a way, it's also somewhat generalizable. That all of these stressors could be destructive, could be negative if they progress to a point that gets us caught up in that negative cycle.
Yeah, because that's it, isn't it? There is, like you say, although people are affected individually, there are general patterns that you can see evolve with individual people. It's like, well, you kind of all fall under the same label, or you went all down the same track. It's just...
Right. I mean, part of my work is pattern recognition, right? And it's using collective experiences to help individual clients, right? I think there is probably a lot to say about kind of the shared experience of people throughout history, right? And certain themes and motifs that do pop up repeatedly over time. I think we have to be aware of that and understand that there are probably a lot of common challenges, because then we can use that to help. So I think that's part of it, but also, like you said, tailoring that with individual treatment, of course.
Yeah. Why do you think there's still a stigma around it?
I think, the stigma around mental health goes back, as early as probably human history. I think part of it probably is the lack of objectivity. Like I said, if you have a brain tumor, we can see that on an MRI, right? But if you have, like you said, depression or panic attacks or schizophrenia, right? There's no blood test for that. There's no scan that can show that. So there's probably part of that. I think there's a strong misperception that, it's a weakness, that it's a deficit, right? Nobody blames you for having type 1 diabetes. Right. Yeah. But if you're sad, if you're depressed, everyone thinks, just, don't be sad anymore. It's seen more as a choice, which I think is unfortunate. And I think, honestly, probably reflects a lack of education, a lack of understanding, and sometimes even just a lack of personal experience. If you've never gone through a major depressive episode, if you've never had suicidal thoughts, sometimes those things seem so inconceivable that it's just hard to relate to that. And when people can't relate, that leads to judgment, that leads to negative feelings, which then kind of just fuels a cycle. So there's probably a lot of reasons, but I think those are probably some of the top ones.
What advice would you give to somebody? Because I think sometimes people get trapped because they don't realise. So actually, let me backtrack. I was about to say, because I think most people don't realise that they're going to... if you're not careful, you're going to go down this road of having a mental health crisis, whether it be anxiety attacks, depression. What would you say? Because like you were saying, the earlier you can meet somebody, the easier it is to help them. What should people look for?
Well, I think a big piece of this is education and awareness. So like, what is healthy anxiety? What is not healthy anxiety? So maybe seeking out some resources, talking to people. I think if you have the concern, reaching out to a therapist or a psychiatrist or a mental health professional is always good. Even if it's more preventative, right? So I think, learning to recognize kind of red flags, maybe, and having it just be more part of the thought process, right? Like if you're going through a hard time, I think there's maybe a tendency to think, well, once I get a new job or once I move or once all these other things change, then I'll feel better, right? But maybe starting to at least involve mental health in some of those discussions of like, hey, could it be anxiety? Could it be depression? Like if we ask the question, there's no harm in asking the question, right? There's a chance it's not, and maybe things are well balanced and maybe things will work out, but maybe it is. So I think just having it be more part of the discussion, more something that people are aware of, will go a really long way.
So, because that is a common human thing, isn't it? I'll be okay when or if, and like you say, maybe it's not the job that bothers you. Maybe moving somewhere isn't going to help you. It's not going to. Because on one hand, it takes a lot of courage to realise, actually, I do need to change careers or I do need to move. But then sometimes, I suppose that's it, isn't it? There's no certainty.
Right. That's a really good point. And you can't fix something that you don't know exists or you don't believe in, right?
Yeah.
So in order to fix it, you have to acknowledge it. You have to recognize that it's a possibility and then think about it as such.
How would somebody recognize that, though? I mean, because it's easy to car crashes. Everybody can see a car crash. Nobody sees them before they happen.
Right. Yeah, I think there's there's both subjective and objective measures. So objective could be things like, showing up late for work, maybe isolating more, not going to family functions, not maybe taking care of yourself as well, eating, drinking, showering, that kind of thing, right? There's things that we can see in the world. And then there's also the internal symptoms of feeling, like you can't control your worry, or you're feeling down, where, all you want to do is lay in bed all day, right? Those kind of things. I think there's kind of both the subjective and objective, and sometimes other people can help, right? Talk to family members, have people who you know and trust to check in on you, and do the same for them as well. So I think it's partly recognizing the objective signs when they're there. Like I said, decreased performance, decreased self-care, those sorts of things. But also just your personal experience. Sometimes the signs aren't visible. Sometimes people are going about their daily life. They look just fine on the outside, but inside are really struggling.
Okay. Just quickly, but before we finish up, where can people find you, and what would you suggest people, like, for resources where they should go?
Absolutely. So my website is jimmymoleymd.com. That has all of my information, ways to get in touch with me if you'd like a consultation or more information. And I would say, for mental health in general, I think it's important to look at trusted resources. So, online, just, I would say, be careful in general, right? There's a lot of misinformation, but trusted resources, whether that be through, like in the US, right, the APA does a good job, I think, of providing good resources. There's international groups, and there's certain hospital systems, I think, that are very reliable. So trusted resources online, trusted professionals in your area. And personally, like I said, jimmymoleymd.com if you'd like more information or to have a chat.
Cool. And my last question, which is completely random, I want you to, using your imagination, I want you to think about a time machine. The time machine, I want it to be some type of car. What type of car would it be? Where would you go? And what would be playing on the radio?
Wow, that's a great question. I'm big Frank Sinatra fan, so I'd probably like to go back to the Sinatra heyday, right? So I don't know. I'm imagining like a really nice like town car, right? Like kind of that old vintage style,
Yeah.
and going back to maybe Pyramid at the Garden or some historic venue. I think that would be the top of the list.
That'd be nice. Seeing Sinatra in his prime would be phenomenal.
Right.
Like you said, no, I can feel that would be, that would be stunning, because back in his prime, that was a sight to see. But that's perfect. Thank you very much for your time. I've really enjoyed talking to you.
Thanks, David. Appreciate your time as well.
And there you go. That was my conversation with Dr. Jimmy Moley. Please do check him out. The links will be in the description. And yeah, if you are struggling, reach out, talk to somebody, leave a comment. You never know who might be able to help you, or who will engage. If I see it myself, I'll engage. But don't struggle alone. And that's the important part, is we might not always have the answers, but as the old saying goes, a problem shared is a problem aired. So, as always, thank you very much for watching, for listening. Thank you, everybody, for the support. And wherever you are, whatever you believe, please do take care and be blessed. Thank you very much.